Hi, I'm DJ Gallagher, and I'm on the advisory board for the Crisis Café here in Newry. I also go to SRC College in Armagh.
Hi, I'm Dara Doyle. I am the co-chair of the Crisis Cafe Young Advisory Board.
Hi, I'm Ciara and I'm on the advisory board for Crisis Café, and I also help run the LGBTQ plus support group here.
Hi, I'm Siobhan O'Neill. I'm the mental health champion for Northern Ireland.
I wanted to ask, what do you think of the current services in Northern Ireland surrounding mental health that are provided for young people, and do you think there's a place for newer services with different aims or focuses moving forward?
So I think a lot of the conversation around mental health services has been so negative, and there's actually some really good services out there, and I hear all the time about people who've been helped through mental health services, and I meet staff who are delivering services and they're doing such a great job, but there's just not enough of them, and it's getting to the right service at the right time, not having to wait too long. The waiting lists are a significant problem, and some people really benefit, so it's important to say that, but far too many people are left kind of asking for help, not getting help, and then sometimes it can make them feel worse. And then sometimes whenever they do get help, it's not the right sort of help. And again, it's this sort of situation where if you ask for help and you get the wrong sort of help, it can contribute to the problem that we're talking about, which is not on. So I want to see more easily accessible services. I want to see people getting help at an earlier stage, so that people aren't told, well, you're not really serious enough, you're not severe enough to be getting the help from our service, you don't meet the criteria. Gosh, I hear that far, far too much. Mm-hmm. So it's about getting the help at an earlier stage and getting the right sort of help, and actually making the most of all those people out there who want to work in mental health services. So I come from a university psychology department, and we have nearly 100 students every year, and a lot of them, I would maybe say the majority, want to work in our mental health services. That's what they see a career in psychology as, and it's just so sad that we don't have jobs for all of them, and we don't have that workforce planning piece done yet. So yeah, mental health services, not all bad, sometimes really, really great, but we just need a whole shake up and a lot more of those services. So I hope that answers your question.
Yeah. Do you think maybe the lack of funding that we have for mental health services and the massive waiting lists that we are faced with, do you think that's creating a rush to discharge patients, and maybe that's seen as the not severe enough because maybe a lot of the professionals are thinking there's maybe 10 or 12 people on that waiting list who've been waiting a long time that need help more, and in reality a lot of people are going through the system not getting the help they need, and maybe they come back 10 times worse?
Well, if you're a manager of a service and you have a big huge waiting list, you want to cut that down some way, and and it's as much about getting people to the right help. So you have to have criteria. You do have to have criteria for a service, but sometimes then you're sending people away and there's nothing for them. Whereas if we had the right kind of assessment at the start, and that's why I keep bringing it back to mental health workers in primary care and GP practices, then they will be able to work out what the right service is, so we don't have people going inappropriately to child and adolescent mental health services. I think there's also a lot we could do digitally as well. These devices that we carry around with us, they're ways of connecting there. They can support our mental health too. They can help us while we're on a waiting list. So there's lots of stuff there. And then even the social prescribing, I think there's not enough of that. Sometimes, you can be helped for your mental health just by going to a group, meeting people who are going through similar experiences and talking to them. So we need a lot more of that. We need a lot more mental health supports through creative stuff. And then, and the other side of it, when you're discharged from, some of these services have criteria for the number of sessions. It's 6 sessions, and that's not realistic if somebody's coming with a serious mental health issue.
And it's not just then the patient that's suffering from that, it's the nurses, the practitioners.
Yeah.
The mental health nurses in particular are incredibly overworked and underfunded, and they don't want to have to only take people who meet a certain criteria, and they don't want to only do 10 sessions and then push them out.
Yeah.
But that's what they're left with, so they just have to do the best they can. And the amount of people, both my parents work in mental health, and the amount of people that they're friends with and they work with that are now leaving or going to do something else, and are so my mum comes home from work sometimes and is like, I'm just going to get a job in Tesco. Because it's draining on
it's
the workers as
staff.
well as the the people, because people go into these roles wanting to help, and then the red tape is stopping them and the lack of funding. So I think a massive issue is like pushing the government to like restructure how we view it, and also have far more funding, and because it's affecting the workers and people that are suffering.
Yeah, they need to get rid of the limits, and they just need to make the most of the workforce that they have as well, so that and yeah, 10 sessions, 6 sessions is not enough for, it's too much for other people as well, you know, so setting this sort of tight criteria is not helpful for anybody.
A lot of people are pushed into like CBT because it's the quickest or the easiest method of care, when it's not always, like you were saying, it's not always the best method of care, and it can actually, because it's not the best, it can make things worse. Like I know CBT didn't work for me, and like I hated it, and it was just continuously like, this is what we're gonna do, and you can't really do anything about it, and it did not work for me. And as well as that, what you were saying about the getting in before it gets bad, because you have to really be like completely unable to go to school, unable to do anything, or you're suicidal before you get help. And the fact is that I talk to so many people, they aren't at that point, but if they had a therapist or someone to talk to right now, they would never get to that point. And that point, the fact that so many people have met that point is horrific, and the fact that that's seen as normal and teen angst to be in so much pain is disgusting, really.
Yeah, I mean, it is about your own personal psychological pain. And that connection between a young person and the therapist is so important, and that has to be right, regardless of what modality, you know, the therapist use. And if that relationship's not there, and if you've got somebody who's struggling with their own mental health or stress, even, you know, it's not going to be conducive to a really good outcome there. So some really good points there.
I think that's what's great about the Crisis Cafe here, is a lot of it is you can come here for as long as you need, and you can come back at any time. And even you were saying, like the social isolation, like prescribing maybe a group to go to instead of like a therapy. Whenever we were here, like in our lockdown, whenever like we finally got the green flag to open up and have people back in, I just saw the positive effect it had on so many people, because we were all so isolated and alone, and here there was this amazing place with such a great stance on mental health, and it was bringing us all together and giving us a place to go when we had nowhere.
Because that's what recovery looks like. It's having your life back. It's creating a life that's worth living for you. And places like this can help do that. So it's not just about your sessions of therapy. You know, that's only a very, very small part of it.
In terms of the education system, what can be done or is being done to improve the mental health of students?
Well, the Department for Education have a framework for emotional health and well-being in schools. You know, so this is a set of guidelines and an approach to transforming the way this is dealt with in schools. So it's about a whole school approach, where you take the whole school environment, but then also looking at individual interventions within that. So you've got resilience building, training people on coping skills, and then providing those links out to mental health and other services where young people need them. But it's starting thinking about the school as an environment that can be mental health promoting, or trauma inducing, depending on what way you look at it. But you know, this for me is just the start. I think we need to really look at our education system, and even the exam system. You know, the outcomes, the focus on grades all the time, and what that does to young people's self-worth. I think that's something we need to look at. And you know, Western society generally has a difficulty with this. It's not unique to Northern Ireland, but I think our system here might be a bit worse than other places, because we have, you know, the whole selection at 11, and that we do to young people, and sort of separate them out at that age. I think that's the start of it, and I think that's really, really harmful. What's your experiences of the education system and how it impacts on your mental health?
Well, I know that I definitely, education, like exams and stuff like that, has definitely contributed to my like past struggles, and definitely is still contributing to it. In my previous school, I was very low, and I had to repeat a year, and when I came back to repeat a year, they basically said to me that I can't drop subjects, like 3 subjects, because it's not the norm. I was told I'm not normal. And I was also told that if I needed a place to go, or if I was feeling overstimulated because I have autism, that they have students all the time running down the halls in tears looking for a place to go when they can sit in their office. And like, once again, it's seen as normal to be on the verge of a breakdown at any given moment because of an education system, because of your school and the stresses of that, and that's not normal at all. Children shouldn't be going through that.
But you can't learn whenever you're scared and nervous and anxious. Like your fight or flight response is switched on then, and that is your kind of running away or withdrawing state. It's not the place where you can learn and be curious and be excited, because education should be a place where we can learn about the world and discover our own strengths. And the exam system is just about measuring people against each other and talking about norms and stuff. Yeah,
And especially after COVID, I haven't done a proper exam in like 2 years. Then in January is my first actual exam back, and I'm completely unprepared for that. There's not really, after COVID and everything that's happened, there's not really the preparation and the readiness for it, but we're still expected to perform the same.
Yeah,
And it's difficult.
that is really difficult, and it impacts then on what you want to do afterwards, because these grades really do matter. So that's it's a fundamental problem. Is there anything we could do in schools, to start to make that right, to start to address some of this?
I think that the route we took during quarantine and COVID was a really good route. Wasn't one big test at the end of the year we have to stress and worry for. It was over the course of a year, you had lots of chances to prove yourself in order to get a score, and it seemed more fair and had overall a better score for what you've done in that year. I think we should go back to doing that.
Yeah, because that shows actual learning.
Yeah, that's just
rather
actual
than just
learning.
a cram and then getting all the knowledge out, and then I don't remember most of the stuff I had to do for GCSE exams. But over lockdown, when we were handing in separate pieces of work and coursework and stuff like that, I know that stuff now, and that's a better judgment of my knowledge than any exam that I've done.
So it's really important we take the learning from the pandemic and try and apply it going forward and what worked. Is there any lines of communication between groups like yourselves and the education authority or the people who set the curriculum? Are they listening to you basically?
No. It's difficult because we're the young people. We're not going to be in a room with the education authority, but I don't know. I feel like there sort of should be the chance for it. We are the people that are subjected to what they decide is the best course of action for our curriculum, and I think other than the Secondary Students' Union of Northern Ireland, which was formed completely out of the coronavirus pandemic, there was no input from young people about what was fair and right about our education system and what we were being put under. And I feel there's a complete lack of their regard for our mental health. There's such a sink or swim environment in school. If you fall behind, it's you're failing the test and there is a deadline. This is the day you're going to be examined, and this will decide, this is going to go on your CV, your personal statement. Universities are going to look at that, and it just feels far too much pressure for any of us.
It also feels if the majority are doing okay, and by okay I mean they're in intense pain but are managing to get good results, then that's fine. But it's the minority who can't handle that, who maybe aren't neurotypical, who are struggling in different ways, who maybe aren't don't have as many finances and stuff like that. Those are the ones that will suffer and won't get those good grades, and it doesn't feel like that is cared about because they're not the majority. It's about getting as many good grades as possible and just getting on with it rather than the individual need.
But there's harm being caused as well, and it's not good that the majority's in intense pain. That's terrible. That's really that's an unacceptable situation.
Because you can look at someone's grades and they're amazing, and then you actually talk to the person and they're really struggling and they're under intense stress, and that even if they're getting good results, what matters is that as a child, you're talking to a child that is really struggling, and that will be lasting for the rest of their life because of it.
Yeah, well, the harm that's been done is very difficult then when the person's entering the workplace. They're not as productive, they're not doing jobs that they want to do, they're not themselves, they're no good to the economy either. And a very, and that's the whole idea of the education system, is to try to prepare people for the real world, but
it doesn't.
It doesn't, that's not your experience.
No.
I mean, I know the Children's Commissioner is doing a lot of work on a rights-based approach and has advocated for young people with all of those government bodies, but it just sounds like we need so much more listening and so many more mechanisms to hear the voice of young people, so that they can influence things for the better.
There's also a lack of urgency on the needs of young people. For example, I'm trying, for my school at the minute, I'm trying to make the uniform more gender neutral.
Yeah.
And this has been going on for like 2 years, and there is a complete lack of urgency, but this is a really important issue that many people, I'm going to be out of the school next year, so it won't even affect me because they can't do anything about it right now because it's up to the Board of Governors. So it's the lack of urgency for not just that issue, but every issue. They're treating it as though it can be fixed later on, but people are struggling right now.
But yet, if the will's there, that's a really simple thing. I know schools who have they've just got a list. They've just included another option, and it's sorted and dealt with very, very quickly and easily.
Yeah.
You know, yeah. So one thing I'm interested in is what you would like to see from services, mental health services, as young people.
I think the way forward for us should be that due to like people who are LGBT and people who struggle with their gender identity, I think we should normalize asking people when they go into the service, like what they feel comfortable as, like what is their gender and like what their pronouns are, because that would like help them feel more secure and safe in the space. They feel like it actually accepts them.
So these are signs that just help people feel psychologically safe. Yeah.
Start using like more gender neutral terms, not like hello boys, hello girls, hello everyone, or hello you, or like just don't try and box people into a corner, because when they get boxed, that's when they get scared
Right.
and like get more like anxious and stuff like that. I think that's a very important thing that we have to more like roll out in Northern Ireland and everywhere, basically normalize like asking people what they're comfortable with.
Yeah, being more
Yeah.
gender neutral, I suppose.
Yeah.
In terms of how we do things. Great, good answer. Yeah.
Yeah, I agree so much. I feel like just making sure that everybody's comfortable in the services that are provided, because I know like a lot of places, whenever I went to CAMS, there was, I wasn't allowed to have sessions alone whenever I was under 16. I feel like if there was a bit more like catering towards people specifically, like what they need or want to help them like get their recovery, and I think maybe advertising the services available like more, because we're very lucky we have the Crisis Café here. It's what has worked for me in my mental health, but the amount of places that I went to before I had even heard about the Crisis Café, I think that if everybody knew what their options were whenever they're struggling, I think that would be an amazing thing for young people.
Okay, so information about options there, and you really emphasise the importance of privacy, so that
Absolutely.
So it really was a one-to-one session that you were looking for.
I think that's just what some people need. Like I feel like a lot of it could be making services more customized towards the individual, making sure that everyone's comfortable whenever they walk into a service that's supposed to help them with their mental well-being.
Great, thank you.
Yeah, I completely agree with what both of them are saying, particularly with not assuming that someone is cisgender or is straight, because that's just another area where you have to put yourself out of your comfort zone to tell them, which often is very difficult. And there's also the issue of you're not sure when you're going into a professional how they're going to react to that. It's not immediately clear that you're in a safe place to be honest about who you are, and that's it is a terrifying thing. So you just stay quiet and you pretend that isn't a huge influencer on why you're feeling the way you're feeling. I think as well, the issue, it's very clinical, and that adds to the taboo around it. So you're going and it's basically like a hospital waiting room, but it's not. It doesn't have to be like that. Like while you are, it is the same as your physical health, because you have to look after it in the same way and seek treatment in the same way. It's not the same because there's so many other factors that are affecting it, and it's not just going in and you put a cast on my arm. It's going in and I'm really exposing myself to you, and you're supposed to help me with that, and we're supposed to help. But yeah, so I think that is a huge issue, which is why the Crisis Café is so good, because it creates an environment where you're not ashamed to be struggling in any way. You're not put in a place where it's like, shh, don't tell anyone that this is an issue. Like I used to be embarrassed to be seen walking towards CAMS, or like I wouldn't tell people if I had to get out for an appointment. I'd be like, yeah, it's just like a doctor's appointment. I wouldn't tell them I was going to counselling, and I think that is partially because of how clinical it is.
So it creates a stigma around it, and then when you're going for like treatment for your mental health, you've got to talk about stuff that's
Yeah.
quite personal in a way that you don't if it's your physical health. So you need to know that it's safe, that you won't be judged or criticised.
And then it's
Yeah.
again, you tell that to you tell that to your GP.
Yeah.
You tell all these issues to your GP that you would hide from everyone, and then the GP tells that to CAMHS, and then you go to CAMHS, and then maybe you get referred to someone else, and then someone else, and so these are all people that you have to redo everything, which is often very almost traumatic, just having to spill it all out over and over again. And then on top of that, the from youth to adult, the transition from that is very difficult, and it's not always obvious. I'm 18, as a young adult, what do I do now if I need help? I've talked a lot, but one more thing.
Oh, well, we'll just, before you leave, that's something we are trying to change, and there should be changes there happening soon.
Yeah.
So there's a group of people who are looking at that age limit, recognising that's far too young. So a time when you're going through all sorts of other transitions in your life as well, when you're going maybe to college, you're thinking about getting a job and you're leaving school. So that is something that's going to change in the not too distant future.